Cerebral palsy (CP) is a neurological disease. Look at this picture, shows that rehabilitation and findings CT, EEG and MRI detail going on. Introduction. Cerebral palsy is a group of prominent movement disorders that appear in early childhood. It affects muscle tone, posture and movement, and can also impact other functions such as cognition, communication and sensory perception. Definition. CP is defined as a group of disorders affecting a person's ability to move and maintain balance and posture. It is the most common motor disability in childhood. Types. 1. Spastic cerebral palsy characterized by stiff muscles and awkward movements. Classified into A. Spastic dysplasia mainly affects the legs. B. Spastic hemiphilia affects one side of the body. C. Spastic quadriphilia affects all four limbs. Two. Dyskinetic cerebral palsy involves slow and uncontrollable movements. Divided into A. APTITUDE cerebral palsy involved movements especially in the arm, legs and hands. Dystonic CP muscle tone fluctuates, leading to repetitive twisting movements. Three. Ataxic cerebral palsy characterized by lack of coordination and balance. 4. Mixed cerebral palsy combination of the above types. Causes. 1. Prenatal factors, genetic mutations, maternal infections, fetal stroke, brain malformation, lack of oxygen. 2. Prenatal factors, complications during birth leading to brain damage. 3. Postnatal factors, infections, head injury or asphyxia during early childhood. Risk factors. 1. Premature birth. 2. Low birth weight. 3. Multiple birth, twins, triplets. 4. Infections during pregnancy. 5. Complications during labor, delivery. 6. RH incompatibility between motor and child. 7. Exposure to toxic substances during pregnancy. Complications. 1. Intellectual disabilities. 2. Seizures. 3. Vision and hearing impairments. 4. Abnormal sensations and perception. 5. Speech and communication disorders. 6. Musculoskeletal issues such as contractures and scoliosis. Pathophysiology. CP results from damage to the developing brain either prenatally or postnatally. This damage affects the motor control centers of brain, including the cerebral cortex, basal ganglia, cerebellum, and white matter pathways. Here are the steps involved. 1. Prenatal or postnatal insult. 2. Brain damage or malformation. 3. Inflammatory or excitotoxic response. 4. Disruption of neural networks. 5. Motor and functional impairments. 6. Secondary complications. Signs and symptoms. 1. Delayed developmental milestones. 2. Abnormal muscle tone, hypertonia or hypotonia. 3. Unusual posture. 4. Poor coordination and balance. 5. Difficulty with fine motor skills. 6. Involuntary movements. 7. Goit disturbances. Diagnosis. 1. Clinical evaluation. Detailed medical history and physical examination. 2. Neuroimaging, MRI, CT scan to identify brain abnormalities. 3. Other tests, EEG for seizures activity, genetic testing, metabolic testing. Nursing diagnosis. 1. Impaired physical mobility. 2. Risk for injury. 3. Self-care deficit. 4. Impaired verbal communication. 5. Risk for aspiration. 6. Chronic pain. 7. Social isolation. 8. Interrupted family process. Management. 1. Interdisciplinary approach, collaboration among neurologists, physical therapist, occupational therapist, speech therapist, and social workers. 2. Physical therapy to improve muscle strength, coordination, and mobility. 3. Occupational therapy to enhance daily living skill and adaptive techniques. 4. Speech therapy to improve communication skills. 5. Medications, muscle relaxants, anticholinergics, and anticonvulsants. 6. Surgical interventions, orthopedic surgery, selective and dorsal rhizotomy. Treatment. 1. Medication to manage symptoms like spasticity, seizures, and pain. 2. Assistive devices, braces, walkers, wheelchairs. 3. Orthopedic surgery to correct deformities and improve function. 4. Speech and language therapy for communication difficulties. 5. Behavioral therapy to address emotional and psychosocial needs. Psychosocial medicine. 1. Family support, counseling and support groups. 2. Educational interventions, individualized education plans, IEP. 3. Community resources, access to respite care, occasional training, and social services. Prevention. 1. Prenatal care, regular checkups, managing health conditions during pregnancy. 2. Safe delivery practices, proper medical care during labor and delivery. 3. Postnatal care, immunizations, preventing head injuries, managing jaundice. Conclusion. Cerebral palsy is a complex condition requiring a comprehensive and multidisciplinary approach to care. Early diagnosis and intervention can significantly improve quality of life and functional outcomes for individuals with CP. Ongoing support and resources are essential for both the affected individuals and their families. Thank you. Have a good day.